right.
Dr. Joel Pash is the co-founder of Upsize Clinics. They're an organization providing penis enlargement injections, increasing girth without surgery. Welcome to the show, Joel.
Thanks for having me. It's
Yeah,
exciting.
exciting to have you on. Tell us a little about your personal life, some more about your work, and why you do what you do.
Perfect. So my personal life, I'm 47 years old. I'm married. I have a 5-year-old. I'm an anesthesiologist by training. I live in California. I've been an anesthesiologist for about 15 years now. And about 3, 4 years ago, I decided to get into cosmetic medicine. That was kind of a journey of trying to figure out something unique that I could do uh, that isn't already being done. I ended up in the men's health space. Kind of came across actually a marketing guy that I knew that was advertising penis enlargement procedures for another doctor, and that kind of sparked my interest. And here I am several years later, running a business that has about 20 clinics in the United States.
Life's a funny thing.
Yep. Never would have thought I'd be doing this when I was like in anesthesiology residency, for example.
And where did you grow up?
I grew up in Canada, in Calgary.
And got tired of
Maybe,
cold weather, Joel, or
yeah,
what?
yeah, I think it was 2018. Me and my wife left Canada. Mostly the weather, kind of the taxes, the politics, all that. And so we're happy that we ended up here. I used to actually have tickets to the Edmont. I tell people I had tickets to the Edmonton Oilers, which is, the big NHL team there. And I literally went to about a third of the games because it was so cold outside that you have your like 60-inch flat screen TV, and it's minus 35 degrees out. And even though you've paid for the tickets and all that, you just don't want to do the parking and walking outside. So that's how cold it is.
Yeah, yeah. You can kind of say that to people, but unless you experience it, you don't completely understand. So I appreciate it having grown up in northern Minnesota, which is not quite that, but close enough probably. So
It could be worse. Isn't that near Winnipeg?
yeah, it's kind of
Manitoba?
it's kind
Yeah,
of directly south of Winnipeg. So who
which
knows?
is, the coldest place in the world,
Right,
probably. So,
right. So you went to medical school a little bit later in life.
yeah, I was 26, I think, when I went.
Okay.
I
Oh, so
finished
so
med school when I was 30.
so no. Okay. So you
Well, like
it was
3, 4 years later than the average, I guess.
okay, got it. And were you always an entrepreneurial kind of a guy? And you mentioned you wanted to do something, I think you said creative.
Yeah, so I actually, when I was younger, I was a musician. I'm a guitar player and a bass player. And when I was like 15 or 16 years old, I was in a band and I ended up getting into concert promoting. And so that was in Canada in the early 90s when alt rock was a big thing and punk rock and all that. And so as like a 16, 17, 18-year-old, I was booking shows in nightclubs in
Awesome.
Calgary. And then I ended up in university and business school, and I was doing the same thing there. And then I ended up when I finished business school, I did management consulting for 3 years. And at that time was the dot-com bubble burst, I guess is the word. So that would have been around 2001. And at that time, I quit my job and went into community college to try to get into medical school.
And here we are.
Here we are, yeah. And again, even at that time, didn't think I'd be a dick enlargement doctor. I thought I'd be
Right.
a normal doctor.
So walk me through kind of the space because certainly erectile dysfunction is giant and we've got all sorts of treatments. Viagra was maybe the first, or at least that's the one that probably jumps into people's minds. This is obviously not that, and it's also not a surgical intervention. So tell me a little bit about how you settled on in the space that you're in.
Well, this particular space was, like I said, I had no idea I was going to be doing anything with penises. And it could have been that someone introduced me to ED treatment, or and I'm not a surgeon, so it wouldn't have been surgery. But the particular thing I was introduced to was the penis filler, which is the thing that I do now. As far as ED goes, obviously, like you said, there's some overlap. ED is probably one of the biggest medical markets that exists. So a lot of the guys that a lot of our patients, I should say, have ED or are getting ED treatment on the side, and this is kind of uh, a supplementary part of that, even though it's not treating ED itself. And then we do have actually offering that does treat ED as well. As far as surgeries go, like I said, I'm not a surgeon, so it wasn't something I could get into, but they can be a little risky, and I discourage people from having surgery. Just, actually, as a anesthesiologist and a doctor, I discourage people from having surgery on anything at all unless they need it, whether it's your penis or your knee or anything.
Yeah.
Um, Surgery in general, like it's not a magic bullet usually. Uh, it's if you need it, you need it, but if not, there's, do physiotherapy or penis filler or one of those things before a major surgery.
Before going under the knife with our
Yeah.
penis. Got it.
Yeah, or your knee or your back or your
Seems,
neck.
yeah, just any of it. So that seems reasonable. So there's probably not too many men out there who, if you said, "Would you like a larger penis?" would say no to that. But what does the market look like? Can you segment it out? These are kind of our ideal prospects.
Yeah, I mean, like, right. If you just said, I'll just wave a magic wand and you can have a bigger unit, everyone would say yeah. Um, Unfortunately, that's not the way it works, right? You actually have to like book an appointment, spend some money, do some research, and have a recovery and all that. So I would say like our average patient is probably between the ages of 25 and 65, which is pretty big range. Reason they're not younger than 25 is usually at that age, you're in college, you're trying to find your first job, like something like that, right? You're not necessarily in that frame of mind. And I have patients that are 80, but I would say at that age, normally you're over it. Like it's your penis is your penis. You're not
Right.
thinking much about it. I'm not saying you're not using it. I'm just saying you've had it for 80 years, so you're probably good.
It's sufficient.
Right. But I do have like I have good stories, and I have 80-year-olds that are hilarious because they are using it still. So that's kind of like the age range. The reason is vast. Some people it can be because of insecurity, but more often than not, it's they're curious. They want to have fun. Maybe their wife had some sort of work done. Maybe they saw a podcast or saw someone else get it done or something like that, right? So it's actually rarely that it's someone just with an overly small penis that wants a bigger penis. It's usually most of the people we have are just fine, and by definition, right? Like average, most people are average, and they just want something more fun, something bigger. But it's people from all walks of life, right? Like I have teachers, dentists, car mechanics, like everything you can think of. Colleagues of mine, right? Anyone any man is a candidate, um, as long as they're healthy and structurally normal and all that.
And all that good stuff. Well, we are certainly going through this time of optimization and hacking, and I, I hadn't really ever thought about it like this whole med spa thing and all these treatments that I would imagine are predominantly women, but more men are probably getting into that, and this would fit into that kind of a category of self-care and
Yeah, totally. It's a growing. I think one of the fastest growing fields in medicine is men's cosmetic medicine, um, and this obviously uniquely fits into that field. It's nowadays, like peptides and hormones are a big thing for men. Botox, like a lot of men are getting Botox now. Um, not so much facial filler, although I do have patients that have gotten facial filler done. And the penis is the newest, most exciting thing that there is. And like we said, surgery is not really an ideal option, and then there's a lot of scams out there. So this option is really a good mix of safety and efficacy.
Penis is the newest and most exciting thing out there. I tell you what,
Right.
what's
Nothing ever
old
changes, right?
is new again, Joel.
Right. People have been putting things in their penis for years. Like this is just the safest one to do.
So walk me through how it actually works.
Um, so so in our clinic, we most of our patients start out by um, sending us a text message or a phone call or whatnot. We have a couple guys that have been with us for a long time that kind of do the preliminary introduction, and if you have any questions, you would call them and they'd answer all the questions. But inevitably, you end up in my office or one of the other doctors' offices. The procedure itself takes about 45 minutes to an hour. Um, Basically, we do some numbing in the skin, we clean everything off, we do some markings with a pen, we inject the filler in the right places so that it looks good and even and all that. Avoid any structures we want to avoid, like the urethra, any major veins and arteries and all that. And then after about an hour of just injecting here and there, it's done. The recovery is about a week, so a week of no sex, but not much recovery otherwise. So, like, people go back and do regular activities, and that's about it. Sometimes, the filler lasts about 2 years on average, and so sometimes guys will come back for more. But yeah, it's a pretty straightforward process.
And what is this filler?
Okay, yeah. So the filler is hyaluronic acid filler. If you see women getting lips injected, that would be the exact same filler. The hyaluronic acid is one of the types of fillers that are out there. The benefit of HA filler is that it is fully dissolvable in the event that there was some sort of issue, which we never have, but if there was, it could be dissolved with an enzyme. And the thing people like about it is that it's naturally occurring in your body. So uh, the cells in our body are in a matrix of hyaluronic acid. Um, and what we're injecting is basically the same, but artificially uh, manufactured, but it's the same chemical compound. So, the thought is we're injecting something in your body that's kind of already in there anyways. That gives it a more natural feeling. It's essentially taking what you have and just making it thicker with in a certain way the same material. And a lot of people like it because you're not putting as much of a foreign body in there. For example, like it's not plastic or metal or silicone or something like that. Um, and so because of that, it has less chance of immune type reactions or allergic reactions. Um, and so that's why we choose that kind of filler. But there are other kinds of fillers out there, and other doctors may use like other types. We just try to go with what we feel to be the safest.
Got it. All right. So um, about 45 minutes to an hour of these injections um, around the penis, and then the result is what?
Yeah, so the main result that people are going to get is a thicker penis. You the way to think about it is that if you just visualize a penis being a cylinder, which it is, you can make it thicker by wrapping a material around it. So if you visualize, say you had Play-Doh and you put it around the penis, it would make it thicker. There's not really a way to make it longer per se, because the only way to do that would be to like cut it in half add some sort of material in the middle and then stretch it out and sew it all back together. And so there's really no procedure in the world that does that, but making it thicker is actually relatively straightforward. Um, and so it's a big one of the big questions we get is, I want to make my penis like 9 inches longer or something like that. And so, well, obviously that's unrealistic, and people need to get a tape measure out and like, you know, it's surprising how often we get that inquiry, but really like it's not possible to add any amount of length on without like I said, cutting things open and grafting materials in and all that, which would it's like saying, can I get a longer leg? How would you do that?
Right.
You get a thicker leg if you just put clothing on, but it's not going to get longer.
Certainly makes sense. So it's the impact is a thicker penis both when flaccid and erect. How does that change the math, if at all?
Yeah, so it's both, because we're adding a material underneath the skin. That material will expand and contract with the whatever natural expansion and contraction of the penis is. So if we make you an inch thicker in circumference, it will always be an inch thicker, no matter what, no matter where you started at. And the as like some listeners might know, or maybe not, if you ask partners out there what the most important attribute is, it's usually thickness that they're looking for. So a lot of guys like want length because they feel like that's what, for whatever reason, they feel like that's what people might want, but it's actually thickness they're looking for. And so in that sense, it's an ideal procedure.
And is there anybody that ought not do this?
Um, I mean, like if you're unhealthy, you might not want to do it. There's guys that don't need it. They're, it, it's not, I guess it's not so common that they don't need it, but maybe a better way to look at it is guys that have like unrealistic expectations more than anything. So those guys might ought not do it. Guys that are maybe have had previous surgeries on there that make the anatomy abnormal. Um, Guys that maybe have some sort of like dysmorphia or something like that, but that's pretty uncommon. For most guys, it's a kind of benign enough uh or minimally invasive enough procedure that it's fine to do.
And are you the most popular guy or least popular guy at cocktail parties?
Um it's everyone wants to talk about it. I've got good stories. I've actually like it's actually my wife more than me because she's more personable than me, but she's actually funny enough, like sold procedures to people at the cocktail parties. Like
Sure.
she'll just be talking to someone's husband or whatever, and next thing you know, that guy's in the office 3 weeks later. Um, no one will. I can't sell anything to anyone, but she can. Um, with me, it's like guys, people want to hear the stories, right? And when I say stories, I mean not like names or specifics, but you could just imagine there's funny things that happen when you come see me.
Yeah, yeah, I certainly can because funny things happen when people come and see me, and
Right.
there's nothing
And
like
you're
what
not
we're
dealing
talking
with their
about here.
penis,
I am
presumably.
not.
Right.
In fact, I've never dealt with another man's penis. So anyway, that's neither here nor there. What I did want to say, doctor, is that I think that a larger penis probably sells itself. So don't walk around saying I can't sell anything to anybody. I don't think that that's true.
It's fair enough. It comes with like here's the problem though. It comes with like a needle going near your penis.
Eh,
Okay, so that's number one.
okay.
It's like that can be daunting, even though I'm saying it's not a big deal. I do it all the time, but not every guy automatically wants that. There's some costs involved with it, so that's the downside, right? Like I said, it's not just a magic wand where I wave it and you get a better one. And it takes some time, right? There's about a 1 week recovery or something. But you're right. If it was just like that, then yeah, it would sell itself.
Got it. Well, I think it's great. I think that you're certainly, I'm sure, providing people with more self-confidence and self-assuredness and increasing happiness for people all over the world. So I think that that's nothing but a good thing. So, Dr. Joel, thank you so much for coming on. Where can people learn more about you? Where can they learn about your work at Upsize Clinics, from pricing and how it works? Where can they get all this info?
Yeah, so you can go to our website, which is www.upsizematters.com. So upsize matters, like size matters.com. We have another website which does training for physicians if you happen to be a physician, and that website is urosculpt.com, uroculpt.com. And I guess we didn't really cover that, but we train a lot of physicians on the procedure. It's obviously something you don't learn in medical school currently. So if someone wants to learn how to do it, we're one of the options.
Excellent. Well, if you enjoyed as much as I did, show Dr. Joel your appreciation. Share today's show with a friend who also appreciates good ideas. Go to upsizematters.com and learn a little bit more about what Joel and I have been talking about today. If you are a physician, check out the other website, which I'll link in the notes of the show, and see if this is something that you want to add into your practice as well. Thanks again, Joel.
Thank you. It's nice talking to you.
Likewise. Till next time, remember, do your part by doing your best.